All right, for our online audience, welcome back. We are ready to get started with our next session of Lightning Talks. We have two presenters joining us. Come on up, don't be shy.
Good. Good. Thank you.
I'm the Deputy Director for Global Health Informatics for okay.
There we go. Okay.
Okay. I have to start again. All right. So I was just saying hi, everyone, and thank you very much for the opportunity for us to talk about our DHIs to work on climate health vulnerability. My name is Abdulhamid Yahaya. I'm the Deputy Director, Global Health Informatics for eHealth Africa. At eHealth Africa, what we do is quite simple. We strengthen health systems and we respond to public health emergencies, especially in vulnerable and underserved communities in Africa. So the climate health vulnerability assessment tool that we're going to be talking about today is quite key, integral to one of our core thematic area, and that's the climate adaptation in health, food security, and nutrition. We have other thematic areas: public health emergency, DPM, that's our disease prevention and monitoring, lab systems, and diagnostics. But it keys the climate adaptation, climate assessment toolkit keys into the climate adaptation thematic area. Then it also aligns with our competency area, which is the global health informatics area. That's where we have about, sorry, I was timing myself. So that's where we have about 60 tech professionals that help to design and deploy digital health solutions. So we've worked in about 22 African countries, and we're still counting. And I think at this stage, I want to leave this yield the floor to my colleague who will take us through more details about the chart. That's the climate health assessment toolkit. But I want to leave you with one caveat. I hope you don't get too excited and say some of the things I've said in the past that I regretted a little bit. I had, after overexcitement, after my presentation in a couple of years back on how we use DHIs during the COVID-19 for management of electronic immunization data, I happened to end with a clause that with DHIs to everything is possible. So I was just super excited. So after the round call died down, one elderly man at the corner now said, "Raises a young boy, I heard you say everything is possible with DHIS2. Which DHIS2 button can I press to send data to the heaven?" So I was like confused. I'm like, to heaven, data to heaven. I've never heard of that before. So just be careful what you say. Thank you very much.
Thank you, Abdulhamid. That was warming. All right, thanks very much. I think just diving into the actual presentation. My name is David Afman, a deputy director with eHealth Africa as well, leading our technical team and also leading some of the digital innovation ideas, working with him closely on the informatics side. So one of the things we thought through as part of work, it's how do we respond to climate change and health, using a data to action approach. So if we then look at that, you're going to most likely be looking at it from how do we strengthen a climate health resilience within the health sector so that they can provide the needed care as it is. We know that climate event, as it continues to happen, it also contribute to expanding, the level of health equity, which is very much a problem in Africa, and as well as also increasing disease morbidity. So that's a very something to worry. But more specifically, as we have health workers, who are actually the front line officers responding to different outbreaks, then it also means that their place of work need to be safe to be able to respond to different outbreaks as the case may be. But we see that being interrupted by climate events. So healthcare facilities are majorly affected whenever there's a climate event occurrence. You also see healthcare services are disrupted. And in that case, it means that we're actually going to be creating a lot of problem to the health response in itself. Low service uptake happens, as the case may be, and healthcare workers themselves perhaps do not have the capacity to respond to any climate health-related emergency, and that becomes challenging. Essential commodity supplies are also disrupted. So within that context, and also leaning towards WHO guideline, you see that there's so much talk about climate change impact on health, but it's less talk about health systems and facility, right? So we face a lot of, if you look down below there, we talk about all the health outcomes, how do we reduce all of that? But there's not so much talked about the smaller box there, which really is where the big problem is, because if that is affected, you will not be able to respond to all of this area of work. And that's where our work focuses on how do you strengthen health system? And within the health system, you have the health infrastructure and which the health facility sits more closely. How do we do that to make sure that our health facility proactively respond to any climate event or a potential climate event that will happen? And that gives rise to the invention of the Climate Health Vulnerability Assessment Toolkit called the CHAT. You know, with University of Oslo, we've heard about CHAP, right? So this is CHAT, right? Charting the way forward. So what is CHAT? Like I did say, Climate Health Vulnerability Assessment Tool is actually a digital tool developed by us, but based on the WHO climate checklist to assess vulnerability in healthcare facilities in the context of climate change. The application is operational in DHIS2 as an open source application. And of course, we have opened a contact there that if you need any form of deployment, then we should be able to provide that support. But let's go into the details. So the chart in itself, like already mentioned, is a digital tool adapted from the WHO Climate Change Health Facility Vulnerability Checklist. It was designed to evaluate resilience of health facilities to climate-related risks. We had initially developed this out of DHIS2 platform because we wanted to deploy and get some level of buy-in from the government themselves or the health facility. So at the pilot phase, we had the intention of ensuring that it allowed for scale and adaptation. We use some way of a modular design because there are several climate events that happens, and you need to make sure that you're developing a system that allows you access different, health facilities for subsequent expansion. But as time goes on, we saw the need of scalability coming in, even to other countries, and that led to developing this on a DHIS2 platform. So I could say now that the chat, it runs on the mobile version of DHIS2 and as well as the web version of DHIS2, and it gives possibility for dashboard integration. So you could have your own customized dashboard integrated into the tool, and it allows you to visualize all of what the data looks like. So in 2025, that's about this year, we had developed this solution to take care of or assess vulnerability across 3 climate events: flood, heat waves, and drought. So if this is applicable to any of the country that experience this, then you could be able to assess your health facility vulnerability across these 3. And we're working towards covering almost about 5 additional climate event areas as well. In the nearest future, most likely this year. This is what the architecture look like we said. So based on the WHO guideline, we've built a generic metadata kit, which DHIS2 allows you to do that. And that has led to having 2 different application interface. So you have the web interface and you have the mobile interface. So you could collect data with the mobile and you run some analytics even with the web application as well. So that's allowed for usability. We're going to see the demo shortly. So how do you use chat? So when you open the chart application. Of course, it allows you know how DHIS2 will possibly require for user details, all of that. But by the time you get that, you go to the interface, it allows you to identify the climate hazard of your concern, and then you commence the assessment. The assessment is structured based on WHO guideline around these 4 domains. It assesses the health workers' capacity. It assesses their capacity around water, sanitation and hygiene, as well as waste management. It assesses their capacity around sustainable energy management, infrastructure, technology, products and processes. And then by the time you complete that, you should be able to see the level of vulnerability of that facility. And it allows for OC level assessment. And you could see that in aggregate to district, in aggregate to state, and aggregate to a country, right? As the case may be. So let's just do a quick demo. I hope the audio will allow us. Ouch, sorry. I went off the slide. I need help. Yeah, there. Yeah, we want to play video from the slide. No. From the, how did you get the slide? This, yeah. Just a 2-minute fade. Yeah. Oh, what happened? It's not showing now as picture. Yeah. It's converted it. But it worked from my end. Yeah, no problem. All right, I think we could proceed if we're able to get that. We can come back to it.
To play it online. Do you want me to try that?
Okay, that's fine.
Wi-Fi is.
Oh, yeah.
Here?
Yeah. Oh, required access. Okay. Oh, okay. Yeah, that's just
We
okay.
shared slides,
Mm-hmm.
so people should be able to access.
To access the view. Makes sense. All right. So we've been told that I'm sure by the time the slides are shared, you should be able to get access to the video. However, if you haven't gotten this, please reach out to it. It will give you some accessibility to the application as well. I think it's on the decks right in front. So maybe moving on. Worked, right? So yeah, because we couldn't get to do the video, we should have shown some demo, but by the time we collect your data, based on the use case we've done in one of the states in Nigeria, this is what it's going to look like on the dashboard. So it shows you vulnerability level across all of the domains that I did mention. And from there, you could see what level of intervention is required for the different facilities. And if you want to do some drill down, this is by different domains, and the red is not like a love sign. That's danger, right? So it shows that this particular state having a health workforce that really do not have the capacity to respond to climate-related events. That's worrying. In fact, we had an issue in January where a lot of flood cases happen in the state, and the health workers were actually very much not, able to respond to different things. So that's what the dashboard looks like, but you could build what it's customized to your own, depending on what you want to see. So that's the postcard I talked about. You could access the application through that, but somehow you will require login details. Yeah, the postcard is right there. Thanks very much. And of course, the earlier slide, you could reach back to us if you want to, any form of support, chat _ DHIS2 at eHealth Africa, and then we'll provide the needed support. So that's all. Thank you. All right.
Thank you guys very much. We will make the slides available online, so everyone should be able to access that video. No worries.
Test, test. Do you hear me well? Okay, thank you much. Thank you much. Hi to all. Nice to meet you here and on the session. And my name is Alexander Marunyak. I work in Alliance for Public Health, Ukraine. And we are talking about very practical tool, streaming data entry in DHIS2 to help our users input data more easy, more natural way. So some context. We work by the grant of Global Fund in Eastern Europe and Middle Asia countries. We have several implementation DHIS2 in different countries. In our countries, Ukraine, but our focus is on the Middle Asia countries, Kyrgyzstan and Tajikistan. Maybe somebody knows Tajik language? No? I don't know too, but it is not a problem. So, Tajik language. When we come to the country with our very best DHIS2, yes, we give to our users DHIS2, we give them Treka and ask, please input data, we will show you, and it is very easy. But what they have the journals like this. And in the journals contains thousands, hundreds, many rows of information. And some context, we work in HIV prevention area. In this area, how it works. So there are social workers. Every day, they go to the fields and work with clients from vulnerable groups. They give some consultation. They give them commodities, syringes, needles, condoms, informational materials. They are performing quick tests. They support their clients to the treatment and after treatment care and other interventions. And all these interventions, from our point of view, should be stored in any way, paper or better DHIS2, and then stored, analysis, reporting, and this standard process. To help our users input data, and we understand that in classical way, they couldn't in fields input data immediately in most cases. Because speaking with the people in prison in in different places, it is not important. So they write some notes, they fill journals, and they will continue this activity. And then this data should be in DHIS2. So we decide to give them the tool like Excel sheet, like paper sheet, but electronic way, but in DHIS2, in which they can input data in the manner they understand, and they clearly see what they are doing. The concept of this solution of this tool is like this. So we have tracker, we have different stages, and in the gray area, user can choose the stage he needs. For example, he gives our clients commodities, and he chooses distribution material stage. Or he make consultation, he choose consultation stage. Then he see the list of his clients in green area, in blue area, necessary rows connected, and some filters and searches for better experience, better work with this tool. In real life, we see the window of DHIS2, classical main menu, and it's in this main menu, we see batch data capture, new tool. When we open, we see the data sets. For example, this solution works in country in Kyrgyzstan more than half of the year, and we have now 3 ready and implemented data set: material distribution, consultation, and testing. The most records, the most events are here. So after choosing data set, we can choose organization unit in classical way, like in DHIS2 from the tree. In most cases, our users belong to one organization, and this occurs automatically. After choosing organization, we see all the clients, and we can filter by region, by age, by key group. It depends on the case. We can search. The most useful in our activity is searching by unique client code. If we didn't find our client, we can register immediately here. And the registration form looks like we use Tracker. Another option is customization. So Tracker has, for example, 20 fields. But different activities need different fields. For example, if I work with one vulnerable group, I give them only syringes, napkins, and consultation. 3 fields. With other second group, for example, I give them condoms, consultation, and something else. So every user can customize the columns of only input data fields he needs. And the first mode, like we work in Excel, like I work in paper, row by row. We find our client, we put 111. For example, syringes here. It's not Tajik language, but I will translate. For example, syringes, the second client gives 2 syringes first type, 2 syringes next type, and consultation. And when we finish the row, we press green OK, and this information immediately comes to the track fields. It's not the separate data, the separate thing. It is like Tracker, but in another form. Good. It is very quick mode. Another thing, when social worker work with with the clients, as a rule, he gives him minimal package. Minimal package, it's a typical. For example, today I work with sex workers and give every sex worker 5 syringes, 5 condoms, and 1 information material. Everybody, today. 10 people. We don't need to input 100. We don't need to input 100 rows. We can select our clients for social worker and only one time write 551 and press OK. And for every from 100 clients, we receive field checker immediately at once. So, as my son said, where is the movie? Yeah, please. and the little movie how it works in real life. The same you see on the screenshot, but so we choose data capture. We choose commodity distribution. So organization, you see that we have organization tree from DHIS2, 3 clients, demo base. Okay, so in real life, hundreds. So vulnerables group or other, in your cases, it can be. Subregion, so it works. Okay, customization. Customization by the columns we have in Tracker. So find clients. If we didn't find, we can add new. Date of birthday. Year of birth in our case. Sex. Gender. 2 letters mother, 2 letter father for creating unique code. And main key group. People living with HIV. And it is from Bishkek, the capital, and some district. So after refreshing list, now it is automatically, we see 4 clients, but there were only 3. So input data, we give him syringes 1 milliliter, please. 1 milliliter. And who is responsible, where the service was done. So the data is written into database. The same for the other client. This is registration date, was second column. We can change. So let's check our tracker about the new data. Okay, we find client. It is not English, but I think it's clear. So 444. And the second mode. We choose social worker. For example, we work with Abil Gazieva. We choose clients. For batch input, we give all of them the same amount, 888, and press save. And that's all. Okay. Thank you. So it's a short demo of real tool we use in our implementation, and users are happy because they input data very quickly in natural way, and less of mistakes because they see all the page at once. And when you input hundreds of data at the same time, it is very useful. As some technical issues, so it is natural for DHIS2. We use organization units tree from DHIS2. We use authentication from DHIS2. As a result, the restriction, system restriction. So a user can see only fields and only stages he has permission. And what we need to implement this, So we need some work. Of course, it is not universal. We try to make it more or less universal for any purposes, but it is not. So universal, we can choose the pattern. We should define which fields and which stages we need, and some work with React application and have solution. So I hope it was interesting and useful. Thank you very much. I am in time. Thank you.
Okay, thanks very much. Let's get our next presentation ready to go. How about Saudigitus?
Yeah.
Okay.
Yes. Okay.
Okay, this is Arndt.
Yeah.
And-
I can start. Hello, can you hear me? Good. Yeah. Good. Thank you. Thank you. Hello. Good afternoon. It's a pleasure to be here. My name is Emilio Moss. I'm a lecturer at university at Eduardo Mondlane University in Mozambique, and also part of this group of young and motivated staff in Saudigitus. And Saudigit is a kind of entity that came from people who really has background in Oslo. Yeah, so kind of we've been in the front hand in terms of try to implement some of these application in different sectors in Mozambique. In this case, we will be talking about the adoption of DHIS platform to manage VSLA, which is a Village Saving Loan Association, now in terms of managing information. So here we will be discussing a little bit about the lesson learned during this process. So probably most of you will be knowing where Mozambique is located. Now, if you look at Africa, there is the green part of the continent. But in this slide, actually, the most important is just to mention, I mean, the extension of the countries. It's a very long, has a very long coast, which is create also a problem. It's very good because we have a very nice climate, but this is also create lots of problem in terms of managing the country. I mean, the government in terms of managing the country. So in this presentation, we want to focus in terms of this fragile financial powers of the rural populations. Now we have a serious problem in terms of the country facing significant challenges regarding the fragile financial power of the rural population. And here we have to focus more on women. This situation is deeply intertwined with the combination of historical, social, and economic factors. So some of these challenges are related with significant less access to formal financial services, especially in rural area. There is a notable gap. There's a statistic saying that women are lying behind 12% compared with men in terms of accessing the services. Also, they are often experienced in terms of having lower financial privacy and autonomous due to prevailing some norms, in most countries, not only in Mozambique, but especially in Africa, that they say that men should be the main financial provider. And also women shouldn't have financial kind of privacy from their husband. This seems very small thing, but this creates a lot of problem for the in rural population, but especially for women. The government also is trying to do some efforts to expand financial inclusion through banking agent and microfinance institution. So there is a lots of small companies trying to create this microfinance institution, because now the government is fomenting the financial inclusion for everybody, especially because in rural area you have lots of people kind of they keep their money at home. So there is a lots of problem that appear. They lose money because of the rain. They lose money because of the thieves and all these things. So all these problem that's created by different factors make the government to kind of set up politics in terms of trying to bring the population or bring the money that the population have through this financial inclusion. So it's very important to understand also that there's a lots of money kind of moving in this what we call informal economy. So it's very important that this kind of challenge, I mean, not that, I mean, this kind of challenge make the government to kind of set up some of the initiative, like for example, economic empowerment. So developing this entrepreneurship, creating job through skill building, vocational training, and also financial literacy, financial inclusion, that promoting saving and loan groups, promoting productive assets and seed funding, and leverage technology, because we should say also that there is a kind of penetration of technology even in rural area, special mobile phones, policy and legal framework, efforts that strengthen law against child marriage and promoting women land rights and economic opportunity, and also some support coming from international organizations, special World Bank and United Nations Women. So all these kind of initiative, they are trying to penetrate in rural area in order to empower the population. But it's exactly because of this penetration that we found opportunity to develop this application or this platform. So these village saving loans groups that exist within the rural area, they were not organized as association at the beginning. So there were small group like NEIGBA, like a group that are working in the same field. So they were kind of securing their money, but they were having lots of problem. So there was a need, I mean, we had lots of small companies that were developing small application for them, but not recognized by the government. So the government, when they saw that there's a need to, because there's a lots of money kind of circulating within this, and also lots of problem that people who are part of this small organization, they were having among them. So there was kind of a need to regulate. So the states open what we call FAR. Now, FAR, it's Economic Rehabilitation Support Fund within the Ministry of Finance in the country. So they ask us to develop a platform that they will bring all this population that are doing this saving in a very formal way, so that also they can get some support from the government. So the platform here that we are presenting was designed to assist FAR at all level. I should say also that they have a kind of 4 levels. For the central level at the ministry, the 3 level at the different regional. So we have south, center, and north part of the country, and also within the province and within the district. And under the district, there is a community. So this FAR is trying to help all these different levels, from the community until the national level. So the platform was designed also to facilitate in managing their routine activity, as well as the regional official in reporting the activity that happen within the community through the main indicator. So the platform is intended to capture, to storage, and data analysis, and also to produce reports in the activity that is happening during their meeting. So I think that's here it's very important to mention in terms of the platform, the structure of the platform. So it developed into kind of two applications. So we have mobile, and also we have web. and they interact between them. So this is comprised of three models, no? The transaction model that registers all transaction that is happening among the members. So there is also a model that manage indicators in terms of what kind of indicator, in terms of mapping the different groups that exist within the community, or the financial, in terms of the money that the government can loan a group of the people that belongs to these entities, and also to strengthen this different community, because they are completely different. In some place you find people who have some kind of understanding of how to use the money, but in some of them they really have lots of problem. So also we have another model that monitor the evaluation, what is happening. So if you take this transaction model, you can see the dashboards, the information that comes on the dashboard. Of course, here we use our money, Metical. So you can see that the different, this small association, they have different amount of money. So it depends of how much each person or each group is putting in this small association. Here also you can see the planned activity that will be going on. I mean, this is very well organized in a small association, that they have planned to do things. They can, for example, set up that on Saturday we will have a meeting at 10 o'clock. So they have to describe what they will be doing there. So at the end, they have the summary that what is happening within these meetings. But at the same time, also we have the indicator, the main indicator management. So these are the things that the Minister of Finance, they want us to put within this system. So you can see here we have a mandatory module that include the module of financial education. So it's a kind of so this is it's like a fashion right now in Mozambique to talk about this financial education, the different products that will be dealt within this small group, and also the efficiency of governance in terms of the money, how they use the money, and also how you register the activity that is going on during these meetings, and also the activity that happen. So people are bringing money. This is not the organization that lend money to people, but the people just save their money within this organization. At the end of the year, they get it back. Yeah, but because people are living together, so sometimes there is a need to help a certain farmer to clean up their field, so they can borrow money from that association, or the others can help them. But at the end of the year, they can really make calculation in terms of how much they've been using. So here the main indicators show exactly how the data and information is collected. So you can see here the name of the association. Here, for example, you can see the number of the number of members that are in this small association. Here you can see the number of I mean, they count in terms of how many adults, how many young, in this specific lesson, until the name of the person, for example, who give the training for this group. Or as I said, we have these two model, web and mobile. The web is mapping the vessel and configure and make some configuration for mobile, capture the main project indicator. They also produce data analysis and reports. The mobile, it's responsible for registration, all members through the life cycle of the organization, recording transaction and saving session, and also assist in managing. It's very important here to mention, and also that the next step that we will be doing is just to link this mobile with the with what we call wallet platform, so people can really put their money through mobile phone. So during using this VIPs, for example, Yeah. I will jump because it's too late. So what we learned here in terms of opportunities that there is a transparency using this application, and also the government has access to what is going on in different in these smaller groups. Inclusion and other saving mechanisms can be included in this. The information, the kind of in real time. So we have remote control, and also the data is secure here. In terms of challenge, we have different group with different activity flow. So because there are many, many groups, more than 3,000 groups. So each group has their own kind of, I would say, the part in terms of developing the strategy within the group. There are constant need to change in the platform. So they keep asking lots of things to be kind of harmonized and be changed. Use also with low technology literacy. So this is a kind of the challenge that we have. Thank you very much. Yeah. Yeah.
Thank you so very much. And let's get ready for our final presenter of the afternoon. Chat. Let's see. We're at OpenFN, right? Ghana? Perfect. And we have 2 headsets. Okay, this one for you. You may have to move the glasses out of the way.
Just hold it like this.
It's a one direction microphone, so the sound
Okay.
is not coming from the right side.
My glass is too big. Hmm?
Correct? Yeah. All right, that's for you. Very good.
Hello, can you hear me?
I see. Okay. Is this okay? Okay, cool. Thank you. So to change. You can click left and right. on the
Okay.
keyboard and thank you so much.
Okay. Yeah, so we are the last presenter, so we can take the rest of the time. Yeah. So we are presenting on generating national IDs for newborn babies in Ghana. And this is actually a collaboration between HISP Ghana, OpenFN, and the Ghana Health Services. So the presentation is structured in such that Alaska will take care of OpenFN to try and introduce OpenFN to you for you to understand the collaboration very well. Then I will take care of the HISP activities, what we did and why we are doing that. And then Kwame will come and give us Ghana Health Services take on the whole project. So you can continue.
Great, thanks, Stephen. Well, hello, good afternoon, everyone. My name is Alexa with OpenFunction. We're a digital public good for data integration and workflow automation. So we help move information between any application, as well as just automate the work that often is like paper pushing, sent over email, exporting stuff to Excel, really trying to get organizations to think about how we can draw lines between systems and turn that into reality, like automated connections. Thank you for moving my slide. So we've been around since 2014, but we've been a digital public good, so fully open source since I think now 3 years now. Work with over 70 organizations, NGOs, social enterprises, and government agencies across 40 different countries. And we're working in this interoperability problem space. So if you want to chat interoperability, come talk to me. But the real heroes are folks like Stephen that are the ones actually putting together these workflows and solutions like we've seen in Ghana. But in terms of like what it is, that's a workflow right there that you can configure and run on OpenFN. And Stephen's going to chat to us a little bit more about what that looks like for Ghana. But we have this interface that provides kind of a visual representation of the integrations, which often are just like bags of scripts and a repository somewhere. And we're trying to make it more visible, like what are those actual processes and steps and systems being connected to have, better conversations between programs people and technical people. But at the end of the day, all of this can be exported as code, run anywhere in the world. We've also recently released, like this week, some new features with templates. So if you're working on DHIS2 integration, in the coming weeks, we're going to have lots of DHIS2 integration templates. So you don't have to start from zero. If you want to connect DHIS2 to an EMR or to a civil registry statistics service, kind of here's some starting points. As well as a new feature with AI, you can literally, in natural language, describe your workflow, and OpenFN will generate something that you can use as a template. So if you check out openfn.org, you can try this out. And the cloud offering that we have is like a free sandbox that you can go experiment with the AI features, and then ultimately export and run anywhere in the world. But we've also got lots of developer tooling just to try to make the integration setup and testing a lot easier. So on the left, we've got some input data. In the middle is, for example, we're trying to create some tracked entity instances in DHIS2. And on the right, your logs and your output. And you'll notice there's that AI assistant, again, that you can go and ask for help in actually writing those scripts and troubleshooting, trying to make the setup process a lot easier. Because in interoperability, it's not the tech that's usually the problem, right? It's a lot of times the people, the coordination, there's a lot more effort that needs to go into it. So we're trying to make the tech a lot simpler. But then we also provide kind of an out-of-box history audit trail console interface so you can track when things fail, because in integrations, things are going to go wrong. So we need to plan for failure. You can design workflows that react automatically to that failure, maybe retry, send the administrator an email. Maybe you want to put all the errors into a separate database for later troubleshooting. Also be able to retry from specific steps. Maybe a system's just down and you want to go and replay. A lot of out-of-box features there. And then it all centers around this concept of adapters, these connectors. We've got over 70 open source adapters. Stephen has built a couple specifically for some Ghana specific systems. So the National Identification Authority, the Birth and Death Registry. But there's also dozens of adapters that work with really common technologies in this space, like DHIS2. And the goal is if you're integrating with DHIS2, don't start from zero, use the adapter for some shortcuts to help you integrate more quickly. We also have some universal adapters that allow you to connect with any application like HTTP, any REST API, it'll work with out of box. Or you can build your own pretty quickly. But yeah, we've been building for this space for a long time. So we build everything around standards. We're a certified digital public good. We are compliant with a lot of these popular architectures like OpenHIE, GovStack. We do a lot of work with supporting in standards like FHIR integration. So if you want to chat a little bit more about that, can speak to how OpenFN supports and complying with whatever regulatory standards, kind of privacy frameworks that you're thinking about in your country. And yeah, you can deploy it anywhere. So as I said, everything's open source, but we also have a cloud offering where you can sandbox today. If you don't want to worry about deployment, there are like subscription offerings where OpenFN will host it for you, or you can run it on your own servers. So there's also lots of community documentation online for help and getting started, or you can go to openfn.org to learn more. But over to Stephen to tell us about what this actually looks like in the real world.
Yeah. Thank you very much, Aleska. So let me just move on so that we manage our time. So the idea is we are generating IDs for newborn babies. In Ghana, we have a situation where people are born not in the hospitals. I think it's a common practice in a lot of African countries where children are born outside the hospital. Now, in Ghana, the tracker has been deployed for these areas where usually what happens is that's when they go to take their immunization. That's when the community health workers go to the community where these people are, and then they group them and try to give them these immunization and then weighing. Now that is where their data is captured into Tracker. Now the problem we are trying to solve is this. In Ghana, we have the birth and death registry, which gives us the birth certificate. We also have the national ID system, which is supposed to be where everybody in Ghana is supposed to have an identity. Now, these people, because they are not born in the hospitals, their data has not been captured right from the beginning. And so they are left out. Now, what this project is doing is that we are trying to make sure that when the community workers start their children, when they register them into Tracker, we are able to get a national certificate, a birth and death certificate for them, and then also get the national ID for them. So we have integrated Tracker with the national ID system, and then the birth and death registry system. And OpenFN is the plumbing that actually allowed us to achieve all these flows. So basically, what Alaska was explaining to you, some of the examples, some of the snapshots were the implementations that we did to let all these things come into play. So let me just we started as a concept with a PHP script just to test how the flow is going to be like. And later we decided to move on with a more solid and scalable implementation. That is why we partnered with OpenFN to achieve these kind of goals. Let me move on to give you the architecture, how it looks like. Now, when you look at the very first activity, so assuming the baby goes to the community health worker, they are registered into Tracker. Now, what happens is that the data comes from Tracker into the BDL, that's the birth and death registry, with OpenFN enabling us to achieve that. Now, the birth certificate is generated from the BDR, and then it comes back to update the Tracker, because there's a field, there's an attribute in Tracker that is supposed to house that data. Now, that data is bundled together and taken into the national ID system to go and generate the national ID for that particular baby. It goes in through OpenFM, the ID is generated, then the data comes back into Tracker as a whole. So now in Tracker, we have both the birth and death ID certificate for the baby and then the national ID. Eventually, when the whole process goes through and is successful, the caregiver is given an alert to tell them that, yes, indeed, the whole process is complete and the baby is registered in both systems and the identity is here. Later, the parents can go to these entities to go and receive the actual physical card that they're going to be using to access any other services going forward. So that is how the flow looks like. And all this plumbing, all these interactions were done with OpenFN. So we built adapters for the SMS connecting to an SMS gateway. We leveraged on there's already an existing DHIS2 adapter in OpenFN that we use to manipulate the DHIS2 communications, but we built separate adapters to communicate with the birth and death registry and then the national ID. There's a little bit of complications with pictures and all that, where we had to do some liveness inclusion from the national ID, where they need to have a picture of the baby to validate with a caregiver's picture and all that. So all those actually happened in the implementation details. So this is just a picture of what of how we did it. The very last day where we had the implementation finished, you could see me there doing this. That's where it happened. Yeah. So we wanted to deploy it in a large scale, but unfortunately, the government changed hands. You know, Africa, when there's a lot of government change hands, things halts and then it has to start again. So we are hoping to actually go live by August this year. Yeah. So I think Kwame would explain further. We don't really have time to demo the actual implementation in OpenFN. You would have seen a lot of flow charts and graphs. So as Alesta was explaining to you, you could have a lot of diagrams. You actually build the logic with drag and drop flows. You would only need to go in to do some plumbing thing when you necessarily need to do that, because you could just leverage on the adapters to achieve what you want to do. Yeah, Kwame.
Hello, I'm up. Yeah. So most of what I have to say has been said, but just to sum everything up, the whole idea is that we're having difficulties in Ghana. I know it's kind of global, but I will only speak for Ghana at this point, with unique identification. I mean, it's something which most countries are still battling with. The whole idea was for us to be able to generate IDs for babies. So right at birth, upon the first engagement with a health worker, the plan is to be able to generate an ID, a national ID for this baby. So what did we do? We introduced the tracker in the health facilities to be able to capture this baby. As soon as the baby is born, first day, we capture the baby into the tracker. Once we have that, for us to, or for you to have a national ID in Ghana, you first need to have a birth certificate. But this is day one. We don't have time to get the baby to the BDR office and do the registrations and do all that. So we had discussions with them and we said that, hey, if we're able to get the data you require digitally, can you generate an ID, a birth certificate ID for us? And they said, yes. So we went through the process of integrating our systems with the birth and death registry. So once we pick the initial data, we send it over to the BDR. They generate a birth certificate ID, and that ID comes back into the tracker. So right at the health facility, in less than a minute, you get that ID ready. Now, for you to have a national ID, because this baby is still young, we need someone to vouch for the baby. And that's a prerequisite for getting a national ID. So we pick a caregiver's details, someone who already has a national ID card to vouch for the baby. And this is necessary because of issues of citizenship. So what we do is that someone vouch for this baby that, yes, this is a baby born to a Ghanaian mother or something which qualifies this baby to be Ghanaian. And for that matter, qualifies the baby to have a national ID. And then we pick the voucher's details, add it to the birth certificate ID, which is a prerequisite, and push that to the NIA, that's the National Identification Authority system. And once they run it on their system and it passes the liveliness test and all the criteria, then they also generate the national ID itself for the baby. So within a minute or a minute and a half, this baby will have a valid national identification number. Of course, the card can be issued later, but with the number, the baby can subscribe to any other service that requires a number, the national identification number. You know, the baby can benefit from any of these services. So this is something we started, and the good thing is that we're able to complete this entire process. And then, as Stephen mentioned, you know, once power changed, most of the heads of the institutions also had to be changed. So we had to hold on the implementation. So technically, it is ready to go. We just need to have clearance, and then this will be initiated. So that is where we are. We have some benefits we are going to get. Of course, we are going to get a birth certificate or a national ID right at the point of registration of every child in a health facility. And then, of course, that will improve data quality because this is going to reduce a lot of human intervention. Once the data is captured once and it passes all the necessary, you know, checks, we have an ID. So it takes out a lot of the human interventions, which hitherto were going to be one of the things that will cause some data quality problems. Long-term impact, we are looking at increased access to identification and service for children because that has been the challenge. And then also, we want to strengthen the collaboration and governance systems in Ghana. So yes, that is the end of the presentation. I'm sure you can see the team. So this team has people from the Ghana Health Services, OpenFN, HISP Ghana, and the BEPS and DEPS registry all together. Very small team, but they've done some great stuff. So I think in clapping for us, we need to clap for them as well. Thank you very much.